I began working with college recovery, I started working here through a friend of mine that was working with the organization already, and it was pretty new in New Jersey in the New Brunswick area. And I had been involved in this field for a little while on a volunteer basis. I do a lot of different work in the community with different community organizations and county organizations, the county coalition and the alliances and the county drug advisory board. Working here was my first job in the behavioral health field, and I became very passionate about this work a number of years ago when I came into recovery myself. So I have personal lived experience in recovery with addiction, with a substance use disorder, and this type of work is something I'm very passionate about. And after identifying a number of organizations in New Jersey that I would like to work for, I landed here, and I was fortunate to get a job here when I asked. I love this place. The main outreach program that I'm involved with is the Sober Outreach Initiative. We partner with different law enforcement agencies and hospital systems to assist individuals that are living with a substance use disorder in the community, people who struggle with drug and alcohol addiction. Our outreach initiative partners directly with law enforcement. We have a team of recovery specialists or recovery coaches on call 24/7. Police department or a hospital is able to call, connect somebody that they have to one of our recovery specialists, and we can help navigate them through the treatment system and also help them access recovery support services when they come home from treatment. We have a number of partnerships in Middlesex County here. We have about 4 hospitals: JFK Hospital in Edison, Raritan Bay in Perth Amboy and in Old Bridge, and Robert Wood Johnson up in Rahway. And we partner with about 7 different police departments so far. Who's made the biggest impact on my life? Oh, geez. It's a combination of people. I guess number one has to be mom. Being there for everything through my own personal struggles, and the biggest cheerleader and encourager, and I wouldn't be who I am or where I am today, without her support. My bosses here, the owners of College Recovery, Phil and Isaac, have been huge influences on me the past couple of years working with them, teaching me a lot. Not only giving me the opportunity and giving me an amazing platform and organization to work with, just being who they are and having the experience that they have, really learning a lot from them, helping me grow. The gentleman, Frank Greenagle, I followed him over here. I knew him. He's a big advocate. He does a lot of work in the communities, an adjunct professor over at Rutgers, does a lot of great stuff. And that's what I strive to be, kind of what I'm like. I like to do a lot of things. I'm always doing something and busy and working and helping somebody in some capacity. So I definitely get some of that from him. It's important to be a part of the chamber, to let other businesses know that we're here, provide the service that we provide, to have businesses know about it, whether it's them directly that need help, behavioral health, mental health, or substance abuse, to know that we're here in New Brunswick providing these services, to be able to tell people that they come in contact with, their customers or anybody that they engage with, to let them know that we're here. The more aware and the more promotion, the more people we're able to help. That's our service is a healing service to people. So being a part of the chamber is really important for us to be able to make that happen, to be a part of that. I always tell people that nothing has changed my life more or provided me more, internal and external gifts than being involved in the community, volunteering. It's tough to put into words or to really describe the benefits that I got and the opportunities that were presented to me, all from just giving back to the community. They say that we're uniquely qualified. People in recovery are uniquely qualified to help somebody that's struggling. Phone's always on. Addiction doesn't sleep. So being accessible, being available for people that need it or family members that need it, whether it's a crisis situation or if somebody in the community just needs to talk about something that they're struggling with. It's important to, be available to help people. Addiction is the #1 public health crisis facing our community today, facing our country, and it's so important to come together. Everybody's affected by it. I always laugh. A lot of people say they don't really have the time to be involved. I can go through the laundry list of things that I do, and we make time for things that are important to us, and to know that we can really have an impact, just by calling up one of our legislators or showing up at one of these public meetings. We can really make a difference, and that's what we need people to do.